Hello, my name is Dr. Yoseph Kale. I am a consultant psychiatrist at Manipal Hospital Patiala. Today, on occasion of World Suicide Prevention Day, we are going to talk about suicide. Suicide or self-harm is a culmination of severe stress, mental suffering, mental pain. It is shocking to know that every 40 seconds, one person around the globe dies because of suicide. As we are speaking, somebody must have lost his life to this preventable cause. In India, every 15 minutes, one person dies by suicide. The suicide rate in India is highest among the South Asian countries. After the pandemic, the suicide rate in India has increased. Currently, in 2023, the recent data says that the suicide rate of India is 12, which is highest since the suicidal deaths have been recorded. What is the cause of suicide? Why somebody commits suicide, and what can be done to prevent this hurtful, painful event? Why somebody commits suicide or dies by suicide is because the person is going through mental pain and mental suffering. The person feels that by taking his or her own life, he can put an end to this suffering. But they do not understand that they are not ending the suffering, but they are just passing on this suffering to their loved ones, to their near and dear ones. It has been seen that a person suffering from depression has 20 times more probability of dying by suicide than a person who is not diagnosed with depression. We as humans tend to ignore our mental health. For example, if we have fever or if we are having pain in any of our parts of body, we rest until and unless the pain is gone or until and unless the fever is gone. But if somebody is suffering from depression, we continue to suffer and we continue to drag ourselves and try and work. We do not seek help. What is the cause of that? Stigma. People, especially in India, label people suffering from mental illness as mad, or as we call in Hindi, pagal. We do not seek help for that. We do not go to mental health professionals. What can be done in this? We should seek help as soon as possible. The stigma should go away. The awareness of mental health needs to increase. Another cause of people dying by suicide after COVID pandemic has been found out to be financial stress. The finances after COVID pandemic has gone down, which has caused increase in suicide rates. So in those cases, one should be aware of this condition. One should plan their own finances. The suicide rate has increased in lower and middle class. We as people of India, we as educated people of India should be aware of the signs and symptoms of depression. Whoever speaks about taking his or her own life should not be taken lightly, should not be mocked at, should not be bullied, but should be taken seriously. Anyone who has ever attempted self-harm or attempted suicide has higher probability of doing it again. So if you or your friends or your relatives have thoughts of suicide, or who are planning to do it, or if somebody is talking about it, do not take it lightly, but bring them to a mental health professional. How to avoid suicidal thoughts? One can engage in healthy lifestyle like maintaining our sleep hygiene, meditation and activities which give you stress-free period or stress-free life. Diet plays a very important role in our mood control. So avoid any fatty foods or any junk foods that causes your body to expend more energy rather than which is required to process simple foods. So diet is very important. Vitamin C containing fruits like citrus fruit are found to have antidepressant effects. Also, plan out leisure activities and vacations. Have breaks during your work period. If you are a IT professional, take breaks every 30 to 45 minutes of around 5 to 10 minutes. Your screen time should be off during that time, and try and do something which makes you feel stress free. Talk to people around you. If you are having deliberate self harm thoughts or suicidal thoughts, talking helps reduce the impulse of dying by suicide. If any of you are having any such issues, I would suggest you to contact a mental health professional, or you can contact us on the number given below. I am always there to help you, and all Manipal Hospital is there, and it's with you in this struggle. Thank you.